As the snow stops, you'll need to eventually get out and be a good neighbor, shovel your walkways. But with that comes a good reminder about your health. 9 News health expert Dr. Payal Kohli joins us now. Good morning.
Hi, good morning, Corey.
So tell us about this link between shoveling snow and heart attacks.
So we found this out actually many years ago from a very old study where we had over 200,000 people present to the hospital after snow-related issues or shoveling-related issues. And out of those, we found out that just under 1% were sudden cardiac death related to heart attacks or heart stopping as a result of shoveling. Interestingly, and not surprisingly, about half of them were soft tissue injuries, so mostly people that fell, hurt themselves, or injured a muscle, and about a third of them actually had low back problems. So lots of things that can happen to us as we're shoveling.
Yeah, you got to lift with the legs, not the back. So what is it about shoveling snow that increases the risk of heart attacks?
Very, very fascinating. It's really the perfect storm of setting your heart up to have a heart attack. So if you think about it, you're out in the cold, which causes increased risk of blood clots to form. It also causes the airway or the amount of oxygen that you're taking in to reduce because your airways tend to constrict a little bit. You get a little bit dehydrated, so your blood can get thicker. You're doing something strenuous, especially if you're not used to doing it. A lot of people that shovel don't exercise regularly, and so that really raises your blood pressure and increases the amount of oxygen that the heart needs. And so you put all of that together, especially in an older person, and you've really created a perfect recipe for a blood clot to form in the blood vessels around the heart, cause stopping of blood flow and cause a heart attack.
Yeah, it can be really so strenuous. That snow can really be heavy. So who shouldn't be shoveling snow?
A lot of my patients ask me this, and there are certain people that I say absolute no to. So if you've had a prior heart attack or a stroke, you have issues with your balance, you have uncontrolled high blood pressure, so your blood pressure tends to run very high, you're not somebody who exercises regularly, a pretty sedentary person, or you're over the age of 55. Those are all sort of rough guidelines for people, and someone who might have moderate to severe asthma. Those are the types of people that should avoid really creating that situation where they could have a medical complication.
Yeah, you really got to look out for your neighbors. Shout out to my father-in-law who takes a snowplow up and down the whole street because they have a lot of elderly on the street, and it's just the right thing to do, which I love. What should we do to optimize our health and reduce our risk?
So you mentioned one of those things, which is to use your back and kind of crouch down. But in general, before you go out, Corey, or if you know somebody else who might be shoveling, you want to make sure that they warm up those muscles because that's going to avoid those soft tissue injuries, muscle strains. Also make sure that they have the right posture when they're shoveling. Lots of water because dehydration is a big piece of this. We're breathing heavier, faster, and it's cold air, so more likely to get dehydrated. You want to take breaks often, and you want to shovel little, like small amounts of snow, rather than kind of big chunks of snow. And then this is the most important. If you don't feel good, you feel tightness in your chest, you feel dizzy or lightheaded, you feel like you're not able to catch your breath, do not keep going. Come inside, call your doctor, or call 911 right away. Seek medical attention.
Absolutely. Great pointers and tips because we're all going to be getting out there today and doing this. Dr. Kohli, thank you.